Hello, you're watching McLaren here on Today's Health, and today we're talking about palliative care with nurse practitioner Joanna Eddy. Welcome.
Hi.
So tell us a little bit for viewers who may not know, what is palliative care?
Palliative care is a model of care for anyone with a serious illness, whether acute or chronic, that they're seeking maybe curative treatment, that we can give support to the patient and the family to kind of help them navigate through the progression of their disease.
So what is the focus or goal of palliative care?
The goal of palliative care is to coordinate with all the providers maybe involved in their care, give support and education to the patient and the family, as well as help them reach end-of-life goals when that's necessary.
So where is the palliative care provided then?
Palliative care is provided wherever that someone calls home, whether it's someone's house, a relative's house, a nursing home, or assisted living.
Great. So are there specific conditions that patients with a specific condition would benefit from?
Yep, it's any serious illness, whether chronic or acute. Maybe someone with cardiac issues like CHF or COPD, someone with dementia, or other things like that.
Wonderful. So this is something I've wondered, and maybe something our viewers have wondered. Is palliative care the same thing as hospice care?
No, it is not. We do support both the patient and the caregiver, but they can seek any treatment that they want, and we kind of help plan maybe their treatment of care and manage symptoms that they might have, say if they're going through chemo or something like that. And we help them develop goals for that when that end of life or maybe hospice is needed, that they know when they're ready.
So it sounds like at some point there comes a shift where you go from one to the other. So how do you know when it's time to make that shift or the treatment goal from care to hospice or a comfort care?
It's everyone's different. It's an individualized plan for the patient and the caregiver, and that's kind of why we're there. You know, hospice is characterized as something when an illness of natural disease progression, they have a life expectancy of 6 months or less.
Great. So you've given us a lot of great information about what palliative care is. If viewers want to learn more about the palliative care services that are offered or are available in this area, where can they go?
They can call the number on their screen or go online.
Wonderful. Well, thanks so much for joining us and giving this great information.
Thanks.
And thank you for joining us. If you'd like any more information about palliative care or the great services that are offered at McLaren Port Huron, you can visit our website, mclaren.org/ph.